Dear students, today I want to continue the previous class, the pathophysiology of edema. So, edema developed due to disturbance of one or more of the above discussed mentioned factor in the last class. So, in most cases more than one factor is involved in the process of edema. Increased vascular permeability is the principal factors to form exudative types of edema which occurs in case of inflammations. Increased capillary hydrostatic pressure is also another important factor in the formation of edema, and decreased colloidal osmotic pressures where the normal plasma albumin plays the role where decrease below than 25 millimeter of mercury. So, the important is when you classify the edema, and usually you will be asked pathophysiologically. So, categorically you will say the edema occurs due to increased vascular permeability, one most important factor, and usually occurs in inflammation. Second factor, where there is a increased vascular permeability, there are several factors where capillary hydrostatic pressure is increased, and another factor is decreased colloidal osmotic pressures, as for example, it occurs in case of nephrotic syndromes, cirrhosis of livers. So, another factor is the hypoproteinemic edema is commonly associated with loss of protein in the urine, poor intake of urine due to poverty, and it leads to less production of plasma protein, especially the serum albumin, and in that case we will call it the nutritional edema. And somebody may ask why nutritional edema occurs. And another factor is less production of serum albumin in liver disease, mostly in cirrhosis of liver. So, the causes of hypoproteinemic edema, loss of protein where occurs in the urine in case of nephrotic syndromes, poor intake, thereby less production of serum albumin in case of famine, that is nutritional edema, and in case of cirrhosis there is the less production of serum albumin in the liver. So, hypoproteinemic edema, these three important factors you must know or you have to produce in the examination hall. Another factor is increased oncotic pressure of the tissue fluids. The colloidal osmotic pressure of the tissue increases when due to increased protein concentration of the interstitial fluid, mainly due to increased vascular permeability, as for example in inflammations, and if there is any lymphatic obstructions. Osmotic tension also increases if there is the retention of sodium. So, if the sodium retention occurs, that means increased sodium concentration in the tissue fluid contribute to the edema. Retention of sodium may result retention of water. It may be due to alteration of renal functions, hormonal influences. So, edema develops where the plasma volumes reduced renal blood flow, thereby GFR reduced. As a result, reduced GFR, juxtaglomerular cells are stimulated to secrete the excess renin. So, juxtaglomerular cells are stimulated to secrete the excess renin. What do renin? This in turn, this renin, excess renin acts on the angiotensin substances that secreted from the liver and produce the angiotensin 1, and finally active angiotensin 2 is produced. This angiotensin 2 stimulate the production of aldosterone by the adrenal cortex. Excess secretion of aldosterone and reduced GFR promote the retention of sodium and water by the kidney and further aggravates the edema. If you see the flow chart, angiotensin system, what happened? Renin released from the kidney. You see the picture, renin released from the kidney and acts on the angiotensinogen, which is secreted from the livers. This renin acts on the angiotensinogen to form the angiotensin 1, which is not activated. With the ACE, that angiotensin converting enzyme released from the lung convert the angiotensin 1 into active angiotensin 2. This angiotensin acts on the blood vessels, constrict, that is narrowing of the blood vessels, increases blood pressure, and acts on the adrenal cortex, that stimulate the release of aldosterone. This aldosterone acts on the kidney and stimulate reabsorptions of sodium and water, thereby aggravates the edema. So, the sodium retention stimulates secretion of ADH by neurohypophysis, which in turn enhance water absorptions in the collecting tubules. And finally, the lymphatic obstruction lead to lymph edema of the tissues. It plays a role in the formation of ascites in case of cirrhosis of liver. I will discuss in the next class the further remaining of the edema. Thank you to you all.